struggling to understand slurred or slow speech. It could be more than just a bad day. It might be dysarthria, a serious speech disorder affecting communication. Here's what you need to know. Dysarthria, a speech disorder affecting communication. Dysarthria is a neurological speech disorder that results in impaired control over the muscles responsible for speaking. Individuals with dysarthria often experience difficulties with articulation, voice quality, pitch, volume, and speech fluency. Although it can profoundly impact verbal communication, dysarthria does not affect a person's cognitive abilities or comprehension of language. Causes of dysarthria. Dysarthria is caused by damage to the nervous system, either in the brain or the nerves that manage muscle movement for speech. This damage may result from a range of medical conditions or injuries, including neurological disorders, stroke, Parkinson's disease, amyotrophic lateral sclerosis, ALS, multiple sclerosis, and brain tumors are among the most common contributors. These conditions disrupt the brain regions or neural pathways that regulate speech motor functions. Traumatic brain injury, TBI head injuries from accidents, falls, or blows to the skull can lead to temporary or permanent speech impairments. Congenital conditions. Disorders such as cerebral palsy and certain genetic syndromes may interfere with normal muscle tone and coordination, affecting the clarity and strength of speech from an early age. Medication side effects. In some cases, specific medications may produce temporary symptoms resembling dysarthria by affecting muscle control or central nervous system functioning. Variability in severity and presentation. The severity and symptoms of dysarthria can vary significantly, depending on the underlying cause, the location of neurological damage, and the individual's overall health. Types of dysarthria, such as spastic, flaccid, ataxic, or hypokinetic, are classified based on the nature of the muscle impairment and speech pattern changes observed. Early recognition and professional evaluation by a speech-language pathologist or neurologist are essential for accurate diagnosis and management. With appropriate therapy and intervention, many individuals with dysarthria can improve their communication abilities and enhance their quality of life. Symptoms of dysarthria. Dysarthria presents with a range of symptoms that reflect impaired control over the muscles involved in speech. Common signs may include slurred speech. Words may appear mumbled, unclear, or blended together, making comprehension difficult. Slow speech. A noticeably reduced speaking rate that may disrupt normal conversational flow. Rapid or rushed speech. Some individuals may speak too quickly, with poor enunciation and reduced intelligibility. Monotone voice. A lack of variation in pitch, rhythm, or loudness, resulting in flat or robotic speech. Weak or breathy voice. Speech may sound faint, strained, or fatigued due to insufficient breath support. Imprecise articulation. Difficulty forming accurate sounds caused by reduced control of the lips, tongue, or jaw. Drooling. Involuntary saliva loss due to poor oral motor control. It is important to understand that symptoms can vary significantly from person to person. The specific presentation depends on the type of dysarthria, the underlying neurological condition, and the extent of muscular involvement. Diagnosis and treatment of dysarthria. Accurate diagnosis of dysarthria requires a comprehensive evaluation by a licensed speech-language pathologist, SLP. This assessment typically includes medical history review, identifying any neurological or systemic conditions that may contribute to the speech disorder. Oral motor examination, evaluating the strength, coordination, and range of motion of the muscles used in speech. Speech assessment, analyzing speech clarity, fluency, rhythm, tone, and vocal quality. Once diagnosed, treatment for dysarthria is highly individualized and focuses on enhancing communication effectiveness. Intervention may include speech therapy exercises, targeted activities to improve articulation, breath support, and oral motor control. Augmentative and alternative communication, AAC assistive tools, such as picture boards, speech-generating devices, or apps to support expressive communication when verbal speech is limited. Lifestyle and medical management, adjusting medications, or treating underlying health conditions that may influence speech function. The success of treatment depends on the cause and severity of the disorder. However, with consistent therapy and support, many individuals with dysarthria can make meaningful improvements in speech clarity and regain confidence in their communication. Living with dysarthria. Living with dysarthria can present ongoing challenges, both emotionally and socially. The condition may lead to frustration, reduced confidence, and social withdrawal due to difficulties in being understood. However, with accurate diagnosis, appropriate treatment, and consistent support, individuals with dysarthria can develop effective communication strategies and maintain a high quality of life. Support from family, friends, and caregivers plays a vital role in fostering better communication. Consider the following strategies when interacting with someone who has dysarthria. Be patient and give the person additional time to express themselves. Maintain eye contact and observe facial cues and gestures to aid understanding. Speak clearly and at a moderate pace, without shouting or exaggerating. Ask clarifying questions respectfully if something is unclear. Minimize background noise to help the listener and speaker focus on the conversation. By increasing awareness of dysarthria and applying simple communication techniques, we can help reduce stigma and foster a more inclusive, understanding environment for individuals living with this speech disorder. For more expert-led health information and guidance on speech and neurological conditions, subscribe to the HeInfo channel today. Don't forget to like, share, and turn on notifications to stay updated with our latest educational videos.